Hi everyone, this is Viel and this is another vlog. Today's gonna be a little bit of a talking vlog, a little bit more talking as usual. I just kind of felt like doing that today. Updates about my life and what I've been up to, I guess, recently. If anybody's interested. I don't really have an interesting life, it's kind of boring. Anyways, welcome to February 2021. And in about a couple of weeks, it is actually going to be exactly 1 year since the pandemic started here in the United States and of course around the world. So I guess I want to start off by saying that I guess when you think about it, compared to the start of the pandemic last year, we're kind of like, in general, nurses were kind of like on a better footing. When I look back to my previous vlog about this, I kind of saw how scared I was, and I still am. 1 year into it, I guess it's just because having experienced like all these surges here in California, me and my colleagues, my coworkers have just gotten a lot better at taking care of patients who are sick from COVID. We're actually better in terms of being more proactive and kind of being more on top of everything, and so a lot more people are getting better faster because nurses and doctors and everywhere in the healthcare field are just much more aware and much more ready of what to expect. Right now, I feel like it's weird because I'm originally a surgical orthopedic nurse and I haven't really had those type of patients in like a year or so. So I feel kind of weird because that's really my specialty as a nurse, and now I feel like COVID and like respiratory pulmonary nursing is kind of like something that I got forced into learning. That before the pandemic, I wasn't really that great at putting like oxygen therapy and pretty much like keeping track of putting patients on what type of oxygen delivery method they need to be on, if they're just on a nasal cannula, like the regular tubing they put on the nose, or a mask, or a non-rebreather, which is like a lot more complicated, or a high flow oxygen, or even a BiPAP, or if they get intubated, put on a ventilator, which I think by now everybody knows what a ventilator is. Me, Verge in the media and the news and everybody talking about it, like everybody's like knows about being on a ventilator and all that stuff. So I guess I feel like being hopeful in the fact that we know a lot more now. But also, on a more serious note, I guess in this vlog I want to mention how burnout in the healthcare industry is real. Almost 1 year into this, we're tired. We're like soldiers who've been battling a war for a whole year with, very faint end in sight. So as I am recording this vlog, we're actually just kind of slowly getting out of the winter surge here in California that started around right before Thanksgiving last year, which quickly snowballed with at one point my entire hospital was just COVID units. And there was just people like getting sick and getting sicker faster, despite everything that we're doing and trying to, our interventions and everything. And they're just like getting sicker faster and faster, and we can't really do anything. And it was just like patient after patient. Like I remember there would be weeks that we didn't have enough nurses. We were on like disaster mode. So each nurses, like they forgoed like the ratios that we had that At one point, we were having like 7 or 8 patients just because we didn't have enough nurses. Nurses and doctors as well. Nurses were getting sick. We were just tired. And even now, I can honestly say there's some days that I'm just so tired that I just can't. Like I think I didn't think about like the long-term effects that this pandemic was gonna have. Especially when I did the last vlog about this, talking about nursing in the time of Corona. And when you're burnt out, you're not at 100%. And that's not a good thing when you're a nurse, because you want to be there giving 100% of compassion and care that you want to your patients and everything you can. But because you're barely holding on yourself, you can't do it. And that saddens me so much. And every day is a revelation of how much, what should I say it? How much I give as a nurse and how much it takes from me. Something I also want to talk about in this vlog, aside from the burnout, is the real, very real parallel pandemic that they call that's going on, aside from COVID-19, that's going on in healthcare. That is the decline of mental health of healthcare professionals like nurses and doctors, respiratory therapists, everybody who's on the job, fighting every day against this virus. Even before the pandemic, I already had anxiety and depression, and it was something that I always was able to manage. It was never severe enough that it affected my life or my daily life at all. It was more of like social anxiety and stuff like that, and occasionally just being like more depressed than usual. And it was something that I was working through with therapy and everything. And before this, I think I felt the stigma of talking about mental health just because as a nurse, I didn't want to appear as somebody who has mental health problems. It's something I want to talk about now just because it's a real thing that's going on, and it's not just me. It's something that's going on with a lot of, if not all, of us in healthcare. I remember in the middle of the year last year, a conversation that I had with my coworkers, one crazy busy 12-hour shift where we were just literally like, it's either a patient would get so bad that they would need to go to the ICU or they would pass away. And then right away, within the next hour, we'd have another patient because patients were waiting in the ER for like hours or even days just to be able to get admitted up to the floor. And a conversation we had was that even if not all of us wanted to admit it, is that we probably have post-traumatic stress disorder from all of this. We probably just developed PTSD from everything we saw. And I mean, I saw things that I don't think I'm ever gonna forget for the rest of my life. There was just things that were too much even to compartmentalize as a nurse. And since the middle of last year, I can honestly say that my anxiety and my depression has gone worse, to a point that there's some days that it disrupts my daily life. Something that people don't realize with anxiety and depression is that it can appear as physical symptoms. For me, I get very nauseous, to the point that I'm vomiting, I am shaking, just from the anxiety and the worry, and like I get like filled with this like overwhelming feel of dread. Days at work or coming into work, it feels like that I'm just dreading of what's gonna come next. Am I gonna make through my shift? Am I actually gonna make through the rest of the week? And I mean, still, I'm working through it through therapy, and you know, continuously taking those steps to be better. But it's something that I think that we fail as healthcare professionals, especially nurses, to talk about, because we fear the stigma, we fear the judgment of it. Last year, in the beginning of the pandemic, nurses and doctors were hailed as like heroes, unsung heroes of this pandemic. And honestly, I mean, this is something most of us in the nursing profession, in the healthcare field, have talked about, is that we don't want to be called heroes. We also don't want to hear that, you know, we signed up for this, because like what one nurse has said is that we didn't sign up to risk our life to catch COVID and die. This is not what we signed up for as healthcare professionals. And for people to ask us to go out there and without PPEs, without enough nurses and staffing, and to take care of patients, knowing that we're risking our lives, is not something we asked for. And that's something that really, when they talk about us before as heroes, really stung, because now 1 year into it, we're burnt out, we're tired, we're emotionally broken. I guess that's the takeaway I want to leave with this talking vlog, I guess, is that we're humans too. We have lives outside of our job, they're like our 12-hour shifts. As much as we're there to empathize and take care and be compassionate to our patients, we're also human beings, and it's okay to take time for yourself. And to any of my healthcare colleagues out there, it's okay to take time for yourself and say, no, I need a break. Because saying that you need a break is better than reaching a breaking point in the middle of a patient that's coding, being responsible for that person's life. So before you can take care of others, take care of yourself. Maybe we're kind of back to normal, how it was before 2020. Maybe we're back to hugging our family members or being able to see them in, you know, normal circumstances and not over Zoom. Maybe we don't have to do funerals of family members or loved ones that we've lost over Zoom or over like FaceTime. Like maybe I don't have to be in there in an isolation room wearing full on like everything in my N95, holding up a phone for a family member just to see their grandpa or their grandma or their family member who's just gasping for breath. And then maybe the next time I do a talking vlog that we're actually better, that in general, as human beings, we're doing better. We took the experience of this pandemic and made ourselves remember what it means to be human, what humanity is about. I'm hoping that when I look back into this vlog, I'm not gonna be crying, or I'm not gonna be reminiscing horrible things in my memory. Hopefully I will look upon it just thinking that I survived, we all survived, and we're all actually better people for it.